Well, welcome back, everyone. We have Elisa Bradley and Tammy Colon from Mental Health and Recovery Services in. And welcome, ladies. It's good to have you here today. Now, what do you want to start out with today, Tammy?
Well, you know, we've been talking over the course of years, particularly since 2021, the role that the Mental Health and Recovery Services Board needs to play in trying to reduce the inequities for mental health and substance use treatment among our communities of color. And so we made a strong investment in 21 when we hired Elisa, who is our health equity and cultural competent consultant. We have a strategic plan in our efforts to try to narrow that gap, all in an effort to build relationships and establish good care for all members of our community. And so Lisa's going to talk about how she's helping us do that.
All right.
Sure. Good afternoon, everyone. My focus is to speak about NAMI, which is the National Association for Mental Illness. And then NAMI is a national organization. There are 49 chapters around the country. Ohio has a very active chapter, and we're very proud that the Mental Health and Recovery Services Board works to support our Allen, Auglaize, and Hardin chapter. And so during this Black History Month, we want to focus on a program called Sharing Hope. It's a part of their national program and their national initiatives to help shine a light on the need for more mental health services and more mental health support in communities of color.
Okay, and then the Sharing Hope program, what exactly is involved in that?
So in a nutshell, it's a 1-hour program after it's established, which is what we're working to do. After it's established, it's a 1-hour program where we focus on the stories of common folks who need to know about resources, who need to know that they are not alone, and who need to know that Allen County has some great resources out there, and we want them to know what's available. So it's a lot about sharing stories.
It is good that, you know, that we do have the resources here in just our backyard, really. You know, that's exciting to hear. And that everyone deals with some sort of mental health issues. We were just discussing this earlier. You know, no matter what your job is or family issue is, or just as a person, you know, with all the stress of social media and whatnot, it doesn't hurt to just ask for a little bit of help sometimes, right?
Right.
That's absolutely correct. Something that is in progress right now is something that the board has sponsored called Mental Health Ambassadors, African Americans Mental Health Ambassadors Program. So what I love about that ambassador program is that it is composed of our everyday folks. We have shop owners, retirees, manufacturing professionals, early childhood educators, and what they've decided to do was they've decided to become more active and more aware, and so they have agreed to multiple phases of training, and then after they have this new knowledge, then they work to change their circles of impact. So we're very excited about our mental health ambassadors. Yeah,
and then for the Sharing Hope program, I know you said it's just beginning, correct? And so it's not like it's not in full play, correct?
That's correct.
All right, so when it does come into play, now how does someone maybe become a part of that? Because it's an exciting new program.
Sure. As it becomes available, there will be some Facebook posts by on our Mental Health We Care People webpage, and there'll also be some community announcements that it's available. And so we're excited to get some people trained and to get some people excited to help our community.
That's great. And then, is there anything else that you want to discuss while you're here? Because you know we have the open forum.
Yeah, no, you know, I
can stay here all day.
We know that one way to reduce the stigma and the space that exists between communities of color and the healthcare profession, you know, which has been long-standing. And while we see a reduction in stigma, we also see an increase in need. And so we really need to develop those relationships. We need to extend ourselves and make ourselves available to the community, which is what the Mental Health Ambassadors have been doing for the last 3 years, and they're doing great work. We just had an event here not that long ago where we had hundreds of folks come. So attending mental health first aid training, joining the ambassadors if you're a person who really wants to be active and trying to encourage folks to challenge their own self-stigma, because that's, you know, that's also there. It's not just the world, but it's what we induce upon ourselves.
That's what we think.
The Mental Health Ambassador is always taking new memberships. And the more people who are familiar with what the symptoms are, what the needs are, what the resources are, you know, the closer we can become in serving them. So
that's great.
We're excited.
That's great. Well, Tammy Colon and Elisa Bradley, thank you so much for joining us today. I do appreciate it.
Yeah, you're welcome. Thank you.
You're welcome. Well, don't go away because medical news is up next.